Hello again, everybody. Welcome into another installment of the Keep Boone Healthy Community Information Channel. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. It has been a while since we have been with you on this channel, and we are going to be coming at you fast and furious for the remainder of the week as we talk about some important things going on in our community. And one of those important topics is revolving around some upcoming changes that we will see related to the quarantine policies that will impact our local school system. The North Carolina Department of Health and Human Services very much at the forefront of this conversation, changing some of those guidance pieces in the toolkit that we've talked about numerous times over the last couple of years to help local school administrators best administer COVID-related policy as it comes to the operation of our schools. So to find out exactly how that's all going to manifest itself here in Watauga County, we bring in our Watauga County Schools expert, that of course being Superintendent Dr. Scott Elliott. And Dr. Elliott, we appreciate your time as always and helping guide us through what is a very complex but also very important conversation here in our community.
It sure is. Thank you, David. It's good to be with you.
So take us through a little bit of the where are we now? I know a lot of people are using public schools as one of those, I guess, community benchmarks to look and see how you are able to operate, not only keeping students in school and keeping them there safely, but also your staffing too. Mirrors a lot of the same challenges that many of us are faced with, and making sure that we can operationally stay moving with still opportunity for viral spread in there as well. So can you give us an update on that?
Yeah, absolutely. So thank you again for the opportunity to talk about this. We have seen a tremendous number of changes that have occurred over the last 2 years as public health officials, researchers, and medical experts have advised us on best practices and how to navigate this, with those changes or those guidelines often changing with better information or experience or with challenges that we face. And I'm really proud of the school system, the students, the parents, teachers, administrators, everyone who's worked so hard and worked together to navigate this. And in many ways, our school system has fared much better and been more successful with this than many others, at least so far as keeping our classrooms open. We've not had to quarantine whole classrooms or close a school or had major disruptions to our athletic seasons or anything like that, where students are having somewhat, back to normal school activities with large school plays and athletic events and club activities and field trips and things like that. But it's not been without its challenges. During this school year alone, we've had our school nurses have recorded about 1,185 students out of our 4,600 students who have been COVID positive. And we have about 720 employees in the school system. And this year, 214 of them have been COVID positive. And even more than that, we also track the presence of the virus and how disruptive it is in our schools by looking at the number of students and staff members who've been quarantined. We've had almost 4,700 instances of student quarantine, some of those with students who've been quarantined multiple times because of their close contact to someone with a positive. And that number's also been very high for our staff. So thousands of close contacts, a couple thousand quarantines for our students. In many ways, it's been disruptive. So first, as an employer, being the third largest employer, it has been a challenge and very important that we kept a healthy workforce in place in order to be able to drive those school buses, provide the school lunches, have teachers in the classrooms, and all the things that are needed to keep school open for our students, because that's been our highest priority. And like many employers, sometimes that's been a great challenge, and we've had to repurpose staff, or we've had to be flexible, myself included, going into the schools and doing different jobs just to make sure that we can keep the basic services of school in operation. And also about students, we've done a lot of remote instruction with individual students so they could still stay connected to their classes. And we've talked about this in your program before, just all the ways that we've had to adapt and new things that we've learned. So all that's to say, it has been disruptive, it has been challenging, and we have managed to survive and continue to keep schools open and healthy and thriving for students. If you want to, we can get a little bit into those new guidelines that that were announced last week, because they are among the most significant changes that we have seen. And I know that the changes have been met with mixed reaction. On the one hand, very exciting because they reflect that the virus, that we're understanding more about the virus, that the most recent variant of the virus, it seems to be having a less negative effect on people's health, and especially on school-age kids, and that we're moving more towards something that we used to call normal. Those changes also have come with a great deal of anxiety and concern among especially some parents who may be concerned that maybe we're moving too fast and moving away from some of the precautions in place. But I believe it's just where we are right now. And we've said all along that we're listening to the public health guidance. So what are the public health officials telling us? And it's significant. Starting Monday, February the 21st, school systems will no longer required to do two things. They will no longer be required to conduct contact tracing. And that is when we know that a person has been in school who has been positive or contagious while they were at school. A student in a classroom, a teacher in the classroom, a bus driver, anyone who's come in contact with other people. So what we are currently doing is we're then looking at who they've been in close contact with and contacting all of those people, testing all of those people, monitoring them for symptoms. Early on, close contacts even had to be quarantined. And most recently, those rules have changed. But that's the second biggest change, is that starting on Monday, unless a student or staff member are showing signs and symptoms of COVID or have tested positive for COVID, no one has to be quarantined anymore. So just because you're a close contact to someone at school, outside of school, or even within families where we know that a lot of the virus has circulated in our community, unless they are symptomatic or test positive, they can continue to stay at school. We've said all along that keeping kids in school has been our highest priority, along with keeping people safe. So it's going to be a significant change, and in my opinion, a very positive one that will keep more students and staff members at school, keep more of our employees at work. These rules also are going to change for childcare providers. And I know that childcare has been a huge concern and limitation for folks and employers and workers and, in fact, school system folks. So I'm also hoping this will also provide a little bit of relief in terms of all children and students and staff members not having to be quarantined anymore. So it's a significant change. I just want to say we will still be doing some notifications. So it isn't as though if there is a case of COVID in a school that no one will find out. But to the extent possible, we may still be doing notifications of whole classes or a whole school whenever cases come into the school so that parents can be aware of that. That said, over the last couple of weeks, our case numbers in the community and in our schools, both the positive cases and the quarantines, have been on the decline. So I really see some brighter days ahead for us, and glimpses of ways in which this virus doesn't preoccupy us every day, at least in schools.
Well, we are all looking forward to that eventuality coming around the corner soon. I know that Monday night at the Board of Education meeting, the lengthy conversation around the mask policy here locally with Watauga County Schools. And again, we are seeing this conversation being brought up with school boards all over the state. What do you foresee with that continued conversation? I know that the vote was to keep masking in place for now, but what does that conversation look like over the next couple of weeks as the board and your staff convene to have conversation about what to do next in that regard?
Well, it is a conversation that is being had not only across the state, but all across the country. You've seen news from whole states and governors and legislatures making laws or passing policies no longer requiring students to wear masks in schools. And in North Carolina, the state really absolved themselves of that decision and left that decision to local boards of education. And I looked at the numbers earlier this week, and still the majority of school systems that serve the majority of students in North Carolina are still requiring masks. But no doubt, increasingly, a number of those districts are moving to a mask optional policy, and in part because of this change from DHHS, where students are no longer going to be quarantined, even if they don't have a mask on, unless they become sick or test positive. So that's a huge change that our Board of Education is taking into consideration. They do have to vote monthly, They did meet this past Monday, and they took a look, as they do every month, at our current metrics, our exclusions, our quarantines, our cases. They're also looking at community transmission numbers and all the things that they've really looked at for a year and a half or two now. What I heard them say is that they all intend to move in the direction of making masks optional, and that they have varying degrees of concern or interest about when to make that decision. Some of them feel comfortable making that decision now. Some of them don't yet feel comfortable making that decision. And that's why the board, or majority of the board, voted to not change the policy. What I also heard was that they directed me to continue to update them on the conditions that are existing within our schools. I track our cases student by student and staff member by staff member every day, and at least a couple of times a week report those to our Board of Education, as well as what kind of operational challenges that we might be facing regarding staffing or anything else, so that the Board of Education members can have a real-time finger on the pulse of what's happening in school, so that they can continue to evaluate their assessment of when they believe it is safe to take the masks off. One of the things that they are cognizant of is that we have a high concentration of people inside our buildings, unlike really anywhere else that exists in the community. And while we know that children are far less prone to serious illness and disease, hospitalization, or death, I heard a few of our board members say they want to see our community metrics improve a little bit more before they make that decision. Now, the good news is we're all seeing that those numbers are falling or improving very rapidly. And so I don't have a crystal ball, and the board has not set a timetable for their decision, but I foresee that change coming. And the reason why that I have been talking openly about seeing that change coming is that I don't want anyone to be surprised by it. And I want all parents and families and employees to begin making the preparations for whatever they feel like they need to do in order to feel comfortable, safe, and healthy in an eventual mask optional environment, whether that is choosing to talk to their doctors about vaccines, or if they've been vaccinated, choosing to have boosters, or whether it is that they have family members in their homes who are seriously at risk and want to protect them with additional vaccines or boosters or good fitting masks or things like that. We, for example, have a number of employees who are highly concerned because they're undergoing cancer treatments or they have compromised immune systems. And so we are working with them to assist them with additional vaccines, good fitting masks for them to wear, and other precautions we've been taking all along around air purification and sanitation and things like that. But the mask optional decision is coming. I can't tell you when, but I believe that it's something that everyone needs to consider and begin to make preparations for.
Well, and I think you've taken that important step, and I appreciate your transparency and the transparency that the Board of Education has allowed you to deliver, and that's setting that expectation of an exit strategy for this. And that is so important when you're talking about these types of things within a community, to help give people an understanding of what exactly it is you're looking at and what some of those opportunities for change may be. Certainly, DHHS guidance changing adds into that conversation, and some of the procedural aspects around what you've been working with certainly do add flavor to this ongoing saga. But we also know too that this is something now that, as you've just detailed, that it comes with an incredible amount of scrutiny, not only from your staff but from the board as well, and that these decisions aren't just made arbitrarily. There's a lot that goes into them, and there's a lot of complexities there. My final question for you, Dr. Elliott, in helping parents understand, and you touched on some of this, but some of that operational difference on Monday when they drop their kids off at school on Monday morning in the car rider line, what should they expect to see in terms of any kind of difference about how school is operating based on some of these new guidelines that the state is putting in place with the quarantine, like you mentioned earlier?
Great. Yeah. Thanks for bringing us back to that and what's happening in schools. So at the end of this week, we will discontinue our large scale contact tracing and quarantine procedures. So what can parents expect on Monday? Parents can expect to send their children to school as normal. Just a reminder, as you just mentioned, the mask requirement is still in place. There are a lot of people who are relieved and happy about that. There are a lot of people who are extremely frustrated by that. I would just ask that parents continue to be supportive of your teachers and your principals. Voice your thoughts or opinions and your needs to your Board of Education members or to me, and I'll convey those to the Board of Education members. But on Monday, students still need to be wearing their masks. That is still the expectation and the rule that's in place. But parents can expect to have fewer and fewer of those phone calls telling them that their child was a close contact or that they need to come and pick them up because they have to be quarantined. So I think we are moving more and more towards normalcy and stability and getting back to the way things used to be. Again, still with the mask. And I do want to point out that even in the districts where masks have remained or have become optional, it doesn't mean that no one's wearing a mask. The DHHS and state and local health department quarantine rules say that after a student or a staff member have tested positive and come back to school for the full 10 days after they test positive or had their last known exposure, they still have to wear a mask. For most people, that will be they're out of school for 5 days and have to come back and wear a mask for 5 days, whether anyone else is or not. Also, there's a federal rule that has not changed yet requiring masks to be worn on public transportation. That includes our yellow school buses and our white activity buses. So again, masks are still required at schools until the Board of Education changes that. But when the board does eventually make that decision, there will still be times when parents need to look in the glove box or go to the washing machine and get out those masks or whatever. We certainly will have them at school and ready for them. I just want to say thank you to the parents for their open and great communication with their school nurses, their teachers, and their principals, even when they've been extremely frustrated, perhaps, through this. I just ask that you continue to do that and know that your school staff members are working as hard as they can to support the families, to love the students, and to keep them in school. We just ask for parents' continued cooperation and help with this until we get to the point that the Board of Education makes a different decision, keeping in mind that the Board of Education has a broad range of constituents. They're trying to keep and balance the needs and perspectives of a large number of students and families and staff members. But as I said earlier, and I hope I'm not getting out ahead of my skis, as we would say up here, but I think that all of these are indications and signs that that we're all moving in the right direction and moving back towards more normal times.
Hey, one of these days soon, maybe we'll have it to where just the only phone calls we get from the school system are Wayne Eberly telling us to stay in bed for a couple more hours in the morning at this time of year. Those were the days. I know we'll get there again soon. Well, thank you again for sharing all of this information, and we'll continue to stay in touch with you and your team as other changes do come. So we can communicate those here through Keep Boone Healthy. But we appreciate your transparency as always, and your willingness to come on and share this news with us. And best to you and your team and your family here as we move forward.
Thank you, David.